helping make your life easier. Moms Every Day.
Scars happen, and there are different types. So how can you best treat scars, and can they disappear? Dr. Margaret Kontras Sutton is here to talk about the ways to approach scars. Nice to see you today, Doctor.
Thank you.
Well, most of us have scars. You get them when you're young from an accident, or you get them later in life too. So they can occur anywhere, can't they?
Absolutely. There are certainly parts of the body that are more likely to scar. For example, the earlobes, the lower face, and the chest.
Will leave more of a scar.
They will.
Can they ever disappear?
And scars can get better on their own and almost disappear. In fact, I usually tell patients to wait a year before they get too alarmed, because a scar will continue to improve for up to a year.
Let's say you've had an accident, like a cut, and you wonder, do I need stitches? Do I not? Will it leave a scar? What happens in that scenario?
Well, pretty much any wound will leave some kind of scar.
Okay.
It might be just a discoloration, or it might be an actual bump, or it could even be a sunken in place.
Any wound will of some sort. Okay, and I've heard that if you're out in the sun and you get a tan, that can make a scar more noticeable.
Absolutely, and we always advise patients to use sun precaution when dealing with a scar.
Okay, well, let's look at some images here today of different types of scars that you might see.
So this is a thickened scar. It's also called a keloid. Certain individuals that are genetically predisposed will get these more commonly.
Okay.
Then there are some other scars. This is a more mature keloid scar that has had time to soften and become less red. So this one's probably over a year old.
Looks a little better.
Yes. Yeah. Here's an example of a surgical scar on a chest, and I included this one because you can see how parts of it scarred much more differently than the other parts. Like the part on the left is much thicker when really it was just the same surgical incision up the whole way.
So how can we treat a scar like that, even years later?
Well, we have to be really careful, because the more we injure the scar, the more it's likely to keloid. So we don't advise re-excising that unless other precautions are taken at the same time. Sometimes we'll actually inject those with cortisone to soften them, and there are some creams that we can try as well.
Can you massage a scar over time, or
Definitely.
put some cream on?
Yeah, massaging is very good to break up the scar tissue. Here's an example of sunken in scars which occur from a bad case of acne. So here's a case where we could actually have prevented the scars by having treated the acne more successfully.
All right, good to know, Doctor. Thank you for being here today.
Great to be here. Thank you.
Yeah, and for more information on Sutton Ryan Dermatology and Aesthetic Center, visit momseveryday.com or download the Moms Everyday app.
Visit Moms Every Day online or on the go through our Moms Every Day app. Download it today to find local solutions for you and your family.